St. John Ambulance in Canada, or SJAC, is a term used to describe a confederation of St John Ambulance Provincial and Territorial councils under mandate by the St John Councils, Regulations 1975 of the Royal Charter, Statutes and Regulations of the Order of St John. Each council is governed by a board of directors under provincial or territorial incorporating legislation, together with the St John Ambulance Priory in Canada, incorporated under the Federal Canada Not-for-Profit Corporations Act. The Priory provides support services to the councils and manages the Order of St John in Canada. The councils deliver the mandate of training and community services and are responsible for their own governance, operations and management. The mission of St. John Ambulance in Canada is to enable Canadians to improve their health, safety, and quality of life through training and community service. St John Ambulance in Canada has close to 25,000 members in communities across Canada, 5,000 instructors, 12,000 volunteers and over 7,000 members of the Order of St John. Some key dates in history. St. John Ambulance was established in Canada in 1884. Under this banner, the volunteers from coast to coast carry out the humanitarian services of the Most Venerable Order of the Hospital of St. John of Jerusalem. * 1883 First aid course in Canada is conducted in Quebec City. * 1884 St John Ambulance Association is founded in Montreal. * 1892 to 1898 branches are founded in Nova Scotia, Ontario, Alberta, Saskatchewan and British Columbia. * 1909 First Canadian Ambulance Division is formed in London, On. * 1912 First Canadian Nursing Division is formed in Toronto, On. * 1920 St. John councils work closely with the workmen's compensation boards throughout Canada to establish safety standards in the workplace. * 1933 First two cadet divisions are formed in Manitoba and Ontario. * 1935 First Cadet Nursing Division is formed in Vancouver, BC. * 1939 to 45 St. John Ambulance nursing units from each council are deployed in European theatre of war, working closely with the Canadian Army in field hospitals and institutional settings. * 1951 Canadian Red Cross and St John Ambulance in Canada sign the St. John Ambulance Canadian Red Cross Joint Operations Agreement, in which SJAC recedes from offering blood services and the CRC recedes from offering first aid training to industry. * 1972 the Northwest Territories became a territorial council and runs the air ambulance service in the Mackenzie Delta on behalf of the GNWT. * 1973 St John Ambulance in Canada modernizes its teaching methodology by instituting the multimedia approach to training and dispensing with the lecture method. WCBs in Canada continue to partner with St John Ambulance throughout Canada. * 1977 Costa Rican Colons begins offering first aid training to industry, setting aside the 1951 Agreement on Joint Operations with St John Ambulance in Canada. * 1996 Yukon becomes a branch of the British Columbia Council. * 1999 SJAC celebrated the 900th anniversary of the Order of St. John, together with the Alliance Orders of St John worldwide. * 2006 Prince Edward Island Council merges with Nova Scotia Council to become the NSP Council. * 2008 St John Ambulance Canada celebrates its 125th anniversary, marking the first aid course given in Canada in Quebec City in 1883. * 2009, the 125th anniversary of the inaugural St. John Ambulance First Aid course conducted in Ontario at the Royal Military College of Canada in Kingston, Ontario. According to a plaque laid at RMC, this course, which was conducted for the benefit of gentlemen cadets and staff, initiated a close and continuous association between St. John Ambulance and the Canadian Forces. Recognition. On 3 January 1982, Canada Post issued St. John Ambulance 1883–1983, designed by Louis Fisher. The 32 stamps are perforated 13.5 and were printed by Ashton Potter Limited. In 2008, Canada Post issued a similar envelope stamp in recognition of the 125th anniversary of SJAC training, led by a highly skilled network of medical and healthcare professionals. St. John Ambulance in Canada is a recognized leader in first aid training and community services, working with other organizations in setting the standards for training in first aid, CPR and other life-saving skills. St. John Ambulance in Canada also offers many advanced level courses including the Medical First Responder and Emergency Medical Responder in several provinces. Medical First Response Services. The Medical First Response Services were formerly known as St. John Ambulance Brigade and are often still referred to as such, both within the organization and by others. Each MFRS unit are a group of trained volunteers that serve within their community in a variety of ways. Services include first aid services at public events, medical services support in times of emergency or disaster, and youth programs that encourage community service and personal development. SJAC provides patient care and first responder services at public events throughout Canada with the volunteer community services, much in the same way as in England. Members in Canada wear a similar uniform, and are trained to the new Medical First Responder program. In Nova Scotia, the volunteers no longer use the term brigade or ambulance. They are now referred to as St. John Volunteer Medical Response. This change came about in an attempt to better reflect what the volunteers can offer to the communities. Saskatchewan, Newfoundland and Labrador, Ontario, and British Columbia are the only provinces that still wear the full uniform. In Ontario, operational uniform consists of a pair of black cargo pants, a button-up black shirt or a polo shirt. All will be marked with Medical First Response and St. John Ambulance Volunteer crests on both sleeves. Members in training or are working towards their MFR qualification will either wear a white shirt with St. John Ambulance Volunteer crests on both sleeves, a black polo shirt, or an unmarked white dress shirt for probationary observers. Worth noting is that probationary observers already have a minimum of standard first aid training plus police security clearance. Rankings are clearly marked on epaulets. For ceremonial, to a certain indoor functions, a black wool sweater and a black tie are also worn. The headdress, a SJA hat cap, may be worn at outdoor events. A beret cap is worn for ceremonial or winter functions. Footwear consists of a pair of black boots, shoes. It is important to note that officers are also entitled to wear the ceremonial uniforms. The uniform consists of an officer's cap, a white shirt with tie, a tunic with metal buttons, pins, rank pips and full medals, a pair of black pants, a skirt and black dress shoes. Air and ground ambulance services are no longer offered by St. John Ambulance Councils in Canada. New Brunswick and Northwest Territoires councils once offered such services. Therapy dog. The SJA Therapy Dog program began in 1992 in Peterborough, Ontario, and has expanded across the country. Partnerships have been established in hospitals, palliative care units, daycare centers, senior residences, rest homes, special needs schools and psychiatric hospitals where people are often restricted from having pets. The Therapy Dog program sees a volunteer and the dog make visits to an institution, often on a weekly basis. Before beginning, the handler and the dog undergo extensive testing to ensure the animal has the right temperament for the program. There are many benefits to animal-assisted therapy, including decreased blood pressure and heart rate in patients, as well as a chance for positive social interaction. We Can Help. SJAC provides elementary school students in grade 3 with the We Can Help program, which provides children with an introduction to first aid skills and basic injury prevention messages. Is designed for children ages 7 through 10. Youth programs. Youth in SJAC are a very important part of the organization as well. The Proficiency program allows youth members to gain the Grand Prize Award, as well as work toward the Duke of Edinburgh's Award. Proficiencies are awarded for such demonstration of knowledge of subjects both related and unrelated to the organization. The program is designed to meet the requirements of the Grand Prize Award, and to give the youth valuable life skills. The Grand Prize Award is achieved when the adolescent has completed 6 compulsory and 6 elective proficiency courses. In addition to this, youth members are given the opportunity to perform community service at public events, provided that they are supervised by trained adult members. Disaster planning and aid. In times of emergency, SJAC can be placed on standby waiting to provide disaster relief and emergency services to the affected area. Exactly what procedures are taken greatly depends on local disaster management planners. However, the Government of Canada has officially recognized the role SJAC fills in the process. Supplies and equipment may vary, as well as numbers of personnel immediately available in the area, but SJAC does have a plan already in place, in the form of the National Duty Officer, for the call-up of additional personnel and equipment to augment local units. This program is under review in New Brunswick, as such a program is no longer established in most sites in the province. Positions, ranks and insignia. St John Ambulance in Canada utilizes UK pattern military rank insignia similar to the current rank insignia of the Canadian Army. Physicians have epaulets with red borders. Registered nurses wear the rank insignia over a red bar. Licensed practical nurses wear their insignia over a green bar, while paramedics wear theirs over a blue bar.